wash my hands. Hi, my name is Charlotte, and I'm an RN, and I'm gonna be doing a full head to toe assessment on you today, okay? Can you tell me your name? All right, how old are you, Annika?
20.
20. Okay, so patient appears to be her stated age of 20, and she is sitting upright and erect and not having any difficulty maintaining her position. I noted when she walked in the room that her gait was steady even without any use of assistive devices. She doesn't have any obvious tics, tremors, or deformities that I can notate here, and seems to have full range of motion. Can you tell me where you're at?
Simulation.
All right, and you know what day it is?
Tuesday.
All right, so she is also alert and oriented ×3 and is conversing with me well. I note over as I look just at general inspection that her skin is a pale tan or pale pink with pink undertones. She's obviously cool, a little bit of mild mottling to the lower extremities from the cold temperature, I'm sure. And she is pleasant and cooperative and calm and again cooperating with me. I note that overall features are symmetric, facial features are symmetric, which shows me cranial nerve 7 is intact. Her body weight is distributed evenly, and she is a normal height for her age, gender, and ethnicity. So, can you say for me light, tight, and dynamite?
Light, tight, dynamite.
All right. So I note that her speech is clear, articulation is clear and understandable. She speaks fluently. Is English your native language? All right. So we should communicate well. And I'm going to look at your hands, both hands. Ooh. She's nervous. No, maybe because her hands are a little bit clammy. But both hands are clean. Their color is consistent. No lesions. I note that the nail beds are pink. Capillary refill is within 2 to 3 seconds. There's no clubbing. Skin turgor is brisk, so showing no signs of dehydration. I'm going to inspect your head, and so I'm just going to look and any pain with the palpation. All right. So she appears to be normocephalic. There's no lesions. I don't notice any infestations. Just looking at where I can see the scalp, is clean. There's no abrasions or anything there. Her hair is blonde and it is pulled back very neatly. It's clean and again, no infestations noted there. So moving to just kind of do some things with your face or check some things on your face. Again, I note that all your features are symmetric. I want to check your temporal temporal artery, sorry. And it is +2 bilaterally. Temporal mandibular joint, can you just open your mouth real wide and close and then do side to side? All right. So there's no real crepitus, a little bit of clunking. Do you have any pain with your jaw? And then can you clench your jaws real tight for me? And don't reopen it. Good. So she's got a strong masseter muscle showing cranial nerve 5 is intact. Can you smile real big for me? Frown. Can you clench your eyes? Can you pop out your cheeks? And then let it go. There you go. And all those things are done well and symmetrically, showing me again cranial nerves 5 and 7 are intact. I'm just going to palpate sinuses. Any pain when I press? All right, so there's no apparent sinus pressure noted there. So moving to your eyes, as I look at your eyes, eyebrows, eyelashes, the hair is distributed evenly. Again, no infestations or loss of hair, bald patches or anything like that. I know that the palpebral fissures are symmetric bilaterally. Can you close your eyes and open? Okay, so she opens up, closes eyes, no signs of ptosis. Just look upwards for me. Conjunctiva are slightly pale, but there's no signs of infection there. The irises are blue, they're flat, and the sclera is a china white, maybe just a mild injections in the corners from, I'm sure you just woke up not long ago. So I'm gonna look at the corneas. Just go ahead and look straight ahead. I don't see any cloudiness to the lens. There's no shattering of the corneas from the sides. And I'm just going to bring this down, look straight ahead again. Corneal light reflex is in the center on each eye, so that is a good sign. Palpebral fissures. Press here, any pain there? All right, no excessive drainage noted. I'm going to do a few tests. So I'm going to have you again look straight ahead, and if you could cover one eye for me, and then I just want you to tell me when you see my fingers in your peripheral vision. All right, great. So peripheral vision is overall intact, showing the cranial nerve 2 is intact. I just again want you to look straight ahead, and I'm just going to move this card. Right, so there is no drift or lag noted, which is a normal finding. I want you to look at my pen light, and I just want you to follow the pen light with just your eyes. She has good smooth movements, and there's no sign of nystagmus noted. So that shows me that cranial nerves 3, 4, and 6 are intact. Can you look up in the center of the room and then look at my pen light and do that again? All right, and so as she looks at the near object, I can note that her eyes converge, eyeballs converge, and the pupils constrict, which is an expected finding. I would say that her pupils are about a 4 to 5 millimeters, and they are even symmetrically. Her pupils are equal, they're round, they react to light, and they accommodate. I did note that when I did that, I'll check that. So as I shine the light in one pupil, I note that both pupils constrict evenly, showing me direct and consensual light, and that shows me the cranial nerves 2 and 3 are intact. Next, I am sorry, it's gonna get dark for a second. I'm hoping, I just realized I hope this is gonna stretch. Look into your fingers. Turn a little bit. All right, so I am going to, and I'm sorry if my back is too, guys. I'm shining the light in, I see the red reflex. And I see the paired vessels, and I can see the optic disc, which is a yellow color, and it has some good demarked borders. The retinal background is a creamy pink color. The macula, I was not able to identify, but I would expect that it would be this diameter away on the temporal side. Okay, so we'll move on to the ears, and just gonna look here. I note that she has a couple piercings on each ear with adornments. I don't see any signs of infection. Do you have any pain with palpation? All right, any pain to the mastoid? All right, great. So no pain. I don't see any external drainage or any drainage coming from outside of the ear. All right, now you turn towards me. Canal is clear. No cerumen. That's always fun when that happens. So the canal is clear as cerumen. Tympanic membrane was intact, pearly gray in color. The pars tensa was at the bottom of the membrane, which is pulled more tightly. Pars flaccida is a little more loose at the top, a little more opaque in color. The umbo in the center and the manubrium coming up off of that, a tonal light was in the 7 o'clock position on the right eye, and the annulus was a red ring around it, or the white ring around it. Okay. Oh shoot! I'm gonna move on to the nose, and just quickly try not to leave this in your nose too long. If you can just tilt your head back. I noticed that the nasal mucosa is a dark red. It's clear. I don't see any gray or blogginess to the mucosa, to the membranes. I was able to see the inferior turbinate, which was consistent with the rest of the mucosa. There was no septal deviation. I noticed I looked at the external nose. Again, no obvious deformity to the nose. Nares are patent. Can you just, and the other side? Great. Tell me what that is. I would accept that. It says it's coconut. Yeah, coconut vanilla, sweeter smell. So I'd say cranial nerve 1 is intact. I want to check hearing, a double hearing test. So I'm just going to have you occlude your ear, the tragus, your ear here, and just repeat the 3 words that I'm going to say. Picture television.
Picture television.
All right, great. So cranial nerve 8 is intact. So I'm going to use the audiometer, and I have it set to 25 decibels for a normal talk. And I'm just going to play this in your ear, and I just want you to raise your hand when you hear beeps. Okay. So you heard 3 out of the 5 beeps. I could try it again with maybe a larger earpiece. It may have been that wasn't large enough to include the outside sound, or I could try it at a higher decibel if I've had concerns. All right. Okay, so I'm just going to inspect your mouth, and I note that your lips are pale, but they are moist, and there's no dry cracking to the lips, which is a normal finding. Oh, okay. Thank you. I'm like, I never know where they put them. All right, so if you can just open your mouth for me. I'm just looking at your teeth. Doing the smile. I see the teeth. All right, open again. I note that her teeth are straight, any pain with on there, and I note that the gums are well approximated to the teeth. Buccal mucosa is a pink color. I don't see any obvious lesions or crack in there. Can you say ah for me? All right, when she phonates, says ah, the soft palate and the uvula rise. And I note that the dorsal side of the tongue is pink. Can you stick your tongue out for me? It's pink and rugated, and I don't see any abnormal like white coating or anything. Can you lift your tongue up for me? On the ventral side of the tongue is glossy. I can see the vessels of that. The floor of the mouth is also glossy. I don't see any obvious lesions there. And when she stuck her tongue out midline, I noted that I can note that cranial nerve 12 is intact. One more time. And gag reflex is intact. I don't see any tonsils.
I have a tonsil.
Okay, so her tonsils have been removed surgically. That's what I kind of want that. Next, if it's okay, I'm gonna just palpate inside of your mouth. Feel any lesions? No lesions on the floor of the mouth. No lesions or any abnormalities to the roof of the mouth. And just check your tongue. Don't notice any lesions to the tongue, and there's no masses or anything like that. I also noted when I was looking in her mouth that the hard palate in the front was a lighter color, rugated. The soft palate in the back was a little bit darker of a color and consistent with the back of the wall. Okay. Next, just want you to taste this and tell me what it tastes like to you. Okay.
Oh, sugar.
Just some hints on these. Don't use really cold water. Make sure it's not raw. Don't use a lot of water either. What's that?
That was nasty.
That was nasty. Okay. I did a good job on that one.
Start with the salt.
Start with the salt. Well, I wasn't sure which one they were. To be really honest. All right.
Okay.
Yeah. It is bottled water. I didn't give you the nasty stuff. So. All right. Okay. So I'm going to move to the neck, noting the neck anteriorly that the shoulder muscles are even and symmetric. I don't notice any masses. I don't see any obvious pulsations to the neck. Just palpate here, palpate the trachea. Trachea is firm. I can feel the cartilaginous rings, which is expected. I'm going to palpate the thyroid. Can you swallow for me? Sorry. All right. I'm barely able to feel the edge of the thyroid that moves down over past my fingers as she swallows, which is a normal finding. There's no enlargement there. I'm going to feel a carotid pulses. Carotid pulse is +2 bilaterally. And I'm going to listen for breathe with the bell. And I don't hear any bruit, which is a normal finding. And I'm going to palpate the lymph nodes. I'm going to palpate preauricular, postauricular, occipital, jugular-digastric or tonsillar, submandibular, submental, cervical chains. And can you shrug your shoulders up? And supraclavicular. And I don't feel any enlarged lymph nodes. They are all non-palpable as expected. I'm going to do some muscles, just check the range of motion and strength of your neck muscles. So I have to look forward and all the way back, ear to shoulder, ear to other shoulder, chin to shoulder, and chin to shoulder. All right. Now I want to do that again against resistance. Forward, backward, ear to shoulder, chin to shoulder, and chin to shoulder. Great. She's a really good job. Very good. 5 out of 5 strength to all of those muscles. Yeah. Can you shrug your shoulders for me and don't let me push them down. All right. And that shows me that cranial nerve 11 is intact. Okay. So I am going to go to your chest. I'm not sure which way. I'm going to have you turn that way. Okay, so I do want to note for this demonstration, but not for your head to toe, I will listen. I'm not going to completely lift her shirt up, so there may be areas that I'm going to listen over clothing, but I should be listening over bare skin. Okay, so as I note, her skin is even in coloration. She's got a few scattered macules. I don't know if it's scarring or if you scratched yourself, because you've got some red marks from scratching on the back. I note that her shoulders are symmetric. Spinous processes seem to be in alignment. Her respirations are easy and unlabored. Chest wall is an elliptical shape. Can you just take a deep breath in for me? So, symmetry of expansion is good. Both sides of the chest move equally. Palpate any pain. So I don't know if there's no tenderness noted. I don't feel any lesions or masses. Any pain when I do that. All right, so no CVA tenderness. I'm gonna percuss over the lung field. Okay, and overall the percussion sound is resonant, which is what I would expect. And next I'm gonna listen to your breath sound. So when you feel my stethoscope, you can just take a nice deep breath in and out through your mouth. All right, great. So all our breath sounds were clear. No adventitious sounds were heard. I got you tactile firmness. So when you feel my hands on your chest, can you just say 99?
99, 99, 99.
Okay, great. So the vibrations were felt more intensely at the top of the chest wall and diminished as I got further away, and they were symmetric bilaterally. Okay, go ahead and turn forward, and I am just going to continue the lung assessment. Again, noting that respirations are easy and unlabored. Tactile firmness, you say 99 again.
99, 99, 99.
All right, and again, the vibrations were equal bilaterally, stronger near the neck and diminished as I got further away. Again, just deep breath in and out through your mouth as you feel my stethoscope. Okay, and again, breath sounds are clear, no adventitious sounds were noted. So I'm going to look at heart assessment, and just looking at the precordium, the overlying chest, I don't see any heaves or lifts. I don't see any obvious pulsations. Palpate valves, and I don't feel any thrills there. I think I'm gonna lay you down to do the apical impulse, but I'm gonna go ahead and for right now I'm gonna listen to the heart sounds. Okay, so I'm listening in the second intercostal space, right sternal border. Second intercostal space, left sternal border. Second intercostal space, third sternal border. Third intercostal space, sternal border. Again, I would do this over bare skin. Fourth intercostal space, left sternal border. Actually, that's more like the fifth. And fifth intercostal space, mid-clavicular line. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Sorry about that. I'm gonna lay your head down now. Note that as I lay her head down, I'm putting her feet up for comfort, and I don't want her. She's already got bad circulation going on down here because it's cold. I don't want that to get worse. Alright, so I'm going to palpate for the apical impulse. Just on women, it's sometimes easier to do lying down. So palpating in the fifth intercostal space, mid-clavicular line. And I can feel a gentle tap, and it's about a 1 by 2 centimeters, which is an expected finding. So now I'm just going to go ahead and look at your abdomen. Do you care if I pull this up just a little bit? It's really hard to fake that. Put this under your hips, because I know that's really comfortable. All right, so as I look at the abdomen, abdomen is overall flat, slightly scaphoid, which is normal for her size and body build. And the umbilicus is midline and inverted. I don't notice any obvious pulsation, maybe a slight pulsation over the aorta if I look real closely, but no bulges, no masses that are obvious on inspection. I'm going to listen to bowel sounds. Bowel sounds are hypoactive. She does have some, probably haven't eaten yet. Oh, you have? Okay, well, they're not moving a whole lot yet, but they will. I'm going to listen for some vascular sounds. I'm going to listen over the aorta. Renal. Renal. And iliac. I hear the bowel sounds better. I don't hear any vascular sounds. No burrowing is noted. I'm going to do some percussion. And overall, I hear timpani sounds. Timpani is heard, and maybe a little of some dullness here, there, and that maybe scattered dullness, but nothing that shows any abnormalities. And I'm going to do palpation, light palpation, noting that the muscle wall is firm but not rigid. I don't note any masses. Just some deeper palpation. Any pain when I'm doing that? Soft. There's no bulging over the spleen is not palpable. Take a deep breath for me. And I barely felt the edge of the liver as she took a deep breath in. It was firm and smooth, which was expected finding. And we'll just palpate for more pulses. Sorry. And +2. And I don't feel any inguinal lymph nodes in the groin area. Can you just kind of like lift your head up for a second there? And I don't notice any bulging or herniation to the lower abdomen groin area. Abdominal reflex. Oh, yep, she's got great abdominal reflexes. No problem there. I'm sorry, I think I shocked you along with it. Just watch the leg. Pull you up. I am laying her, putting the bed up. The jugular veins disappear by the time she's at 45 degrees, so there's no signs of JBV. All right. So I'm going to look at your upper extremities. So go ahead and sit upright for me. And actually, it may be easier just to have you stand up. I should have put that there. Standing up, I want you to raise your arms up over your head, do a full arm circles, great. In and out, flex, wiggle your fingers. Great, now push your arms out to your side, don't want to push up or down or up. Push in or out, sorry. Hands, don't let me bend your wrists, and don't let me squeeze your fingers. I want you to squeeze my fingers. Good job, very strong grip. She's got full range of motion and 5 out of 5 strength bilaterally to the upper extremities. I'm gonna go ahead and do the lower extremities while you're here. Are you able to duck walk? All right, go ahead. Great. So I know that she's able to duck walk without any problem. That tells me that her she has full range of motion and 5 out of 5 strength to her hips, knees, ankles, and feet. While you are standing, I am going to go ahead and just do a Romberg test. So you just stand still, close your eyes, don't let me push you over. All right, great. So the Romberg test is negative. Can you do shallow knee bends? All right, good job. And let's see, can you take a few steps on your toes? And a couple steps on your toes. Good job. Oh, spine. Can you bend forward for me? And looking down the spine, I note that there is no spinal deviation. There's no signs of scoliosis. So then let's finish the range of motion in your spine. Go ahead and twist side to side, forward, backward, and side to side. All right, great. Full range of motion is noted there. Go ahead and sit back down. I note that I did not hear any crepitus to the joints. I'm just going to kind of quickly palpate a couple joints. I don't feel any obvious crepitus or problems with the joints. Any pain with any of that? Okay, great. Now I'm going to check pulses. So I'm going to check your radial pulses. You can do this unilaterally, but radial pulses are +2 bilaterally. Ulnar pulses are +1 bilaterally. Radial pulses +1. Popliteal +1. Posterior tibial is +2. Now I need you. And dorsalis pedis is +2. I know that her feet are cool to touch, which is expected finding with the situation, and she's got pendant. I know there's no infestations, lesions, infection in between the toes. Capillary refill to lower extremities is a little bit sluggish, but again, kind of goes with the dangling of her feet. You can put your sock back on. I note that looking at both arms and legs, that the skin is symmetric. It is consistent with the rest of the body on the legs. Again, there's a little bit of modeling, red, blue kind of streaks because she's cool to touch. I don't note any pretibial edema. I don't see any varicose veins. She shaves her legs, I'm assuming, and so there's no hair growth to note, which is expected in cultural finding. You can have your shoe bags there too. Oops, I got it. All right. So, okay, I'm going to do some neurologic tests. So I just want you to put your hand out here. I want you to close your eyes. I'm going to wiggle your fingers around. I just want you to tell me where they end up or down, okay? I would do it to the toes too. I'm not going to take that off. So, all right, great. So she's got good position sense. close your eyes. I'm gonna put an object in each of your hands. I want you to tell me what you think they are. Okay. Yep. Jaw. Stereognosis. I'm gonna draw a letter in this hand. And I'm gonna draw a number in this hand. Good anesthesia. Can you put your hands on your lap and then flip them over? Now, you could do that several times quickly. All right, good rapid alternating movements. Can you take the heel of one foot and run down the other shin? Okay, good job. And I'm going to check sensation. I'll have you close your eyes. Just tell me when you feel the cotton on your face. I'm going to do sharp and dull sensation. So I want you to see what I have. This is sharp. That's dull. Okay. Okay, great. Good sharp and dull sensation. Vibration sense. So again, with your eyes closed, I am going to touch your wrist and your ankle with this, and I want you to tell me when you feel the vibration and when you feel it stop. Great. Good vibration sense. Okay, now I want you to touch your nose with one hand, put the other one out, close your eyes, and go back and forth with that. That's great. Okay. And reflexes is my favorite. All right. Just want you to relax as much as you can. I got a +1 that one time. I thought I could get a little bit better there. Tricep. I really picked you for having better reflexes. Okay. +1. I feel a little bit of reaction, but I thought I could get one of it. We could see. Just let her go. It's hard to do this. Just kind of like completely let your arm go. Oh, there we go. Got a +2 there. Sorry. +2. Yeah, sorry. This was bicep, tricep, brachioradialis. I just want you to bend your knee up and just relax. And that was +2. Oh, plantar. And she's got a negative plantar or toes curl in, which is fine. And I believe that's the end of my head to toe. I know I missed a couple things. How much time?
10 minutes or 11 minutes.
I love them. Okay, how to do? You don't have to give me a grade, a number grade, but what did I miss?
Did you say if I had good eye contact?
I did not. You're right. I did not say anything about eye contact. I also didn't tell Patriot or whatever to give me. I realized that long after I set her up and just decided it wasn't worth going back for. Really, and with that, it just depends on what your goal is. If you really want to press for that 100%, if you want to go back and get it, it's not going to count against you. But what else? Anything else I missed? What questions do you have? Hoping that you were able to see well enough what I was doing. Obviously, I didn't go in write down the order, and it's fine as long as it makes sense. Part of the reason I like you guys to grade it is because you can sometimes see why we're over there flipping pages around and trying to pay attention to what you're doing at the same time. It's not always simple. Now, I will say ours are back to back, or not back to back, or on both sides. It's more one-sided, so we're not spending as much time flipping things around. Did I get all the cranial nerves? Any questions?
Is there anything that's like critical that we do, like if we don't do something certain, then we fail?
Nope. You've got to pass with 75%. So when we're assessing it, we are watching what we're watching what you're doing, your techniques. Obviously, again, we can't hear with the stethoscope what you can hear. If it's percussion, we may be able to hear it. We can't always see what you're seeing, but we can tell if the technique is correct. We're listening to you say the right things. So naming like the lymph nodes, naming your pulse areas, your reflexes, making sure you grade them, all is worth part of the point. If you forget to do something and you realize it at the end, you can go back and do it. Not a problem, but you cannot repeat something you already did. You cannot come back and tell me, look at your cards and then go, oh yeah, I forgot to tell you all my cranial nerves, here they are. That kind of thing won't work. But if you forgot to do it, you can do it. Low points, again, if you don't put the feet up when you're laying them down, most of us will dock off like a half of a point. We want to make sure you're watching yourself as far as standard precautions. So obviously, don't put glove or don't help it inside of their mouth without a glove on it. That is one I've never seen anybody do. I told you about my glove lady though. In my one that I watched that dropped the glove. So the gal dropped the glove, picked it up, put it on, and stuck it in the patient's mouth. Before I thought she was gonna throw it away, and so and we're not supposed to say anything, so I didn't say anything, and she put it on, and I went, and her hand was in the mouth, and the gal was in the patient's seat, kind of looked at me, and I'm like, roll it now.
Yikes.
I didn't say a word until it was all over, and she was mortified, but that did not fail her. So all that to say, I think I dropped a point or something. There isn't a critical. I said in a real world setting, I am sure nobody would really do that, but it was nerves, and yeah, again, she was mortified, and she's infamous now for it. What else? Let's see. Making sure, again, I could have probably docked myself a half a point because I didn't put the bed all the way down before she got down. Now, because she's not super tall, now if her feet were about on the ground when she got down, that would be fine. If your patient's really tall, not a big deal. But if they've got to jump down off the bed, you should have the bed in the low position. Some of the beds, and here's where it's good to know what room you're assigned to. You should be able to find that on the sign up. What room you're in, what bed you have to use, and learn how to use it. We don't want to see you fiddling around with the bed and not knowing how to work the bed. So some of them have the hydraulics. Some of them have a step that you can pull out when they get down, but some of them don't. And we realize that we're not going to take off points for something you can't. You should have everything well organized, not fumbling around. For the equipment, I would always double check your audiometer before you start. Not because we take points off if it's not working, but it just rattles the student. If it's not working, I'll stop the timer, let you go find one that works, but it will rattle you. Any other questions? I have a list of those types of things, but I don't know if it's already posted on Brightspace, but I can send it to you. It's just tips, things to keep in mind as you're preparing, things that maybe aren't explicitly written on here that